Welcome to Health Talk. Today we have two plastic surgeons with us, and we will be talking about breast reconstruction after breast cancer surgery. Today we have with us Dr. Tom Liu, plastic surgeon from San Jose and Mountain View, and Dr. Jerome Liu, plastic surgeon, also San Jose, Mountain View. They're partners. And we have with us Ina Tunkel, who will help us interview and talk to us. So in breast cancer, right now it affects 1 in 8 women and men in America, and 300,000 new cases are identified each year, and a great many have mastectomy. Tell us a little bit about what do you do now as plastic surgeons after mastectomy. When do you do the reconstructive part?
So there's two categories of reconstruction. One is called immediate reconstruction, where the reconstruction is performed at the time of mastectomy. And the other is delayed reconstruction, where the mastectomy is performed first, the patient recovers, and then comes back months or years later to have a mastectomy, sometimes not even at all. There's more and more techniques and procedures now to optimize the patient's result at the time of mastectomy. And that tends to be the preferences that patients want, because you can have both procedures done simultaneously under one anesthetic event.
You even mentioned that after lumpectomies, plastic surgeons are called in now, even though it's a very small incision.
Yes, with breast conservation surgery or lumpectomies, oftentimes they don't need to have an entire reconstruction, but sometimes the position of that scar can be very important to subsequent reconstructions later on. So breast surgeons and plastic surgeons are now collaborating to see how we can also offer some of our plastic surgery expertise in lumpectomy patients as well.
So typically, a general surgeon would call you into a case after breast cancer mastectomy is performed, and then you would then discuss with the patient preoperatively the options. So what would you say, Jerome, Dr. Liu, what would you say what would the options you would say to the patient?
Yeah, so we work very closely with the breast surgeons, and often we see them soon after or immediately after the breast surgeon sees them. So the patient is given kind of the options for reconstruction. And the current options, there's really two types. There's implant-based reconstruction or alloplastic, and there's also using your own tissue or autologous reconstruction. And there's risks and benefits to both, and we as a practice offer both options to patients so that they can make their own decision with our guidance, of course, as to what might work best for them.
So if, let's say a person has a mastectomy and it's on one side and they choose to have an implant, and as we've discussed that implant surgery and flap surgery goes in stages. So what are the stages? What would you say?
Yeah, so regardless of the type of reconstruction, typically breast reconstruction occurs in 4 stages. They're not all equal stages, but let me outline them for you. The first stage is the creation of the breast mound, which is essentially the most important and the longest recovery. And that is actually recreating the breast at the time of the mastectomy. For an implant-based reconstruction, we insert a tissue expander, which is a temporary implant.
So this would be a tissue expander.
Exactly. So this is a tissue expander. Think of it as a temporary implant. So it has a silicone shell, it's filled with salt water, and it has an adjustable valve, and that allows us to expand and deflate the tissue expander. This gives us a lot of flexibility in adjusting the patient's shape and size to reach their final result. Because sometimes after mastectomy, some women don't want to be the same shape or size as they were before.
And after mastectomy surgery, you also have to work with less skin or more skin.
Yes, actually both are sometimes challenges, which is patients with large or hanging or pendulous breasts, sometimes you have too much skin. And in women with smaller breasts, or if the cancer is close to the skin where a skin margin has to be removed, then you have lack of skin. The other advantage of a tissue expander is also it's one of the only techniques in plastic surgery where by the mechanical force of the tissue expander, you can actually stretch and quote-unquote create new skin.
So this stage, how long does this take?
So for an implant-based reconstruction, the first stage, most patients spend at most two nights in a hospital after surgery. All the subsequent stages are done on an outpatient basis, or sometimes they're even done, they're done in an outpatient basis at a surgery center, or sometimes even in our office.
So after mastectomy, they would get this tissue expander, and then they're in the hospital for 2 days, but this stays for a while the skin tissue around the breast mound is being expanded.
Right, so typically the tissue expander is placed and left in place for about 3 months. At the end of the 3-month period and after they've reached their optimal size and shape, then the second stage occurs where the tissue expander is removed and a permanent implant is placed.
So then the permanent implant would be either one of these, right?
Exactly.
This one?
Exactly. So this is our newest generation silicone gel implant. It's highly cohesive, which means it's firmer, right? And the gel is more kind of solid-like versus more liquid-like. And this is a round, smooth silicone gel implant. So when the patient reaches their optimal size, at the second stage surgery, which is an outpatient procedure, the tissue expander is removed and a permanent implant of the patient's preferred size is placed with some pocket adjustments. For unilateral reconstruction, we also do a symmetry procedure of their uninvolved breasts, which typically involves doing a breast lift or breast reduction to match the reconstructive side.
Now, this is a different type of...
Right. So this is a new option that's now available. This is it's called a highly cohesive, form-stable implant, also known as a gummy bear implant. And what this is just a newer generation of silicone gel where it's a little bit more firmer that allows it to have its anatomic shape. Some patients may benefit from this kind of teardrop design, and it just gives more options to women with breast cancer who need breast reconstruction.
And you said that if this gets surgically incised in half, it stays in 2 pieces.
Yeah,
it
so
doesn't dissolve into the body.
No, so actually with both implants now, with the more cohesive gels, if you were to cut both implants in half and you were to hold it upright, the gel will actually stay in place. It won't run down on the ground or leak. But this one, being more cohesive, it'll look more like 2 solid pieces.
So this is a big improvement from 20 years ago.
Yeah, so some of the prior generation, earlier implants, the companies actually made them very less cohesive or quote-unquote liquid-like, thinking that it would make a softer implant. The problem is when those implants ruptured, the gel just would get would just run all over the place, and it would just be a mess.
So both of you have had experience in this, and what else do you tell patients now after the 3 months and the next stage? When is that next stage? How long, Dr. Jerome Liu? What do you think?
So typically the expander stays in for about 3 months. In some patients it's sooner, some patients are later, just kind of depending on what other treatments they need, whether they need chemotherapy or radiation after mastectomy. But in any case, the second stage occurs usually as an outpatient, so patients can come in for surgery and then go home, and the recovery is much less than the initial operation. So I think that's the important part, is that when you're undergoing breast reconstruction, number one, it's staged, so there's multiple operations, but the big operation is really the first one that occurs with the mastectomy. After the second operation, the subsequent ones, the recovery is much quicker, much simpler. Patients go home and their return to activity is relatively rapid as well.
Now, there's an interesting point also that you mentioned. Some people need radiation, and you were discussing that now with these new techniques, people can still have the plastic surgeons involved in immediate breast reconstruction. Tell us a little bit about that.
Yeah, immediate reconstruction is not a contraindication in patients that need radiation, but it does change the postoperative healing process, and it does change the ultimate reconstructive outline. Patients that do need radiation can still have breast reconstruction, but there are advantages and disadvantages to each type, and I think it's important that we work closely with the radiation oncologists and the breast surgeons to think about their ultimate radiation treatment plans and how the reconstruction can affect that. I think in the past, patients have shied away from reconstruction if they were to need radiation, but now there actually are options available.